Hello, seniors. I am Dr. Robert Harrison. Here's something most seniors are never told. If you're taking magnesium for sleep, muscle cramps, or blood pressure, you may be taking it the wrong way. And that mistake could actually make you feel weaker, more dizzy, or unsteady on your feet. Many older adults assume magnesium is always safe because it's a mineral. But after age 60, your body handles magnesium very differently. In this video, I'll explain the most common magnesium mistakes seniors make, why certain types can be risky, and how to use magnesium the right way to protect your health and independence. As we age, the way our bodies handle minerals quietly but significantly changes. Most people never notice it happening. There's no sudden warning, no clear signal. But inside the body, systems that once worked efficiently begin to slow down. Digestion becomes less effective at absorbing nutrients. Kidney function gradually declines, blood vessels stiffen, nerve signaling becomes less responsive, and yet many older adults continue taking supplements exactly the same way they did decades earlier, especially magnesium. Magnesium is essential. There's no question about that. It supports muscle relaxation, nerve function, heart rhythm, bone strength, and energy production. It also plays a role in regulating blood sugar, supporting sleep, and calming the nervous system. That's why magnesium is one of the most commonly used supplements among seniors. Older adults take magnesium for nighttime leg cramps, for constipation, for anxiety, for sleep problems, for irregular heartbeats, for blood pressure support, and in many cases, magnesium does help. But here's the critical point most people never hear. Magnesium that is helpful at one stage of life can become problematic at another. After the age of 65, the body no longer processes magnesium the same way it once did. The kidneys, which are responsible for removing excess magnesium from the bloodstream, work more slowly. Even mild reductions in kidney efficiency can cause magnesium to linger longer in the body. This doesn't usually cause immediate symptoms. That's what makes it dangerous. Instead, magnesium levels can slowly rise over weeks or months, especially when seniors take higher doses, take multiple magnesium-containing products, or combine magnesium with certain medications. At the same time, aging blood vessels become less flexible. Blood pressure regulation becomes more fragile. The nervous system reacts more slowly to changes in posture, hydration, and circulation. Magnesium relaxes muscles and blood vessels. That's one of its benefits. But in an older adult, too much relaxation can tip the balance. This is why some seniors begin taking magnesium for sleep or cramps, and later start feeling lightheaded when standing up, more fatigued than usual, mentally foggy, or weak in the legs. Many assume these symptoms are just normal aging. They're often not. Another major issue is that most people don't realize magnesium is not a single substance. It comes in many forms, and each form behaves differently in the body. Magnesium oxide is poorly absorbed but stays in the gut. Magnesium citrate is more absorbable and pulls water into the intestines. Magnesium glycinate is calming and strongly absorbed. Magnesium L-threonate crosses into the brain more easily. Yet supplements are often chosen based on price or marketing, not physiology. A label that says 400 milligrams of magnesium does not tell the full story. For a 70-year-old, that dose may be unnecessary or excessive depending on the form, timing, and health status. And then there's the medication issue. Many seniors take blood pressure medications, diuretics, heart rhythm drugs, diabetes medications, or osteoporosis treatments. Magnesium can interact with all of these, sometimes subtly, sometimes significantly. Magnesium can enhance the blood pressure-lowering effect of medications. It can interfere with the absorption of certain drugs. It can worsen dizziness in people prone to orthostatic hypotension. In a younger person, these effects may go unnoticed. In an older adult, they can increase the risk of falls, fainting, and hospitalization. This is why more doctors are beginning to view supplements differently in older patients. Supplements are not harmless just because they're sold over the counter. Magnesium is not dangerous by default, but it is powerful, and powerful substances must be used carefully as the body ages. In the next part of this video, I'm going to explain the most common mistakes seniors make when taking magnesium. Mistakes that seem harmless but can quietly undermine health, balance, and blood pressure. These mistakes are incredibly common. Most people have never been warned about them. And once you hear them, you may realize you've been making one yourself. One of the biggest problems with magnesium in older adults is not that they take it, it's how they take it. The first major mistake I see all the time is taking too much simply because more seems better. Many seniors look at the label and think 400 milligrams is a standard safe dose. After all, that number is printed everywhere. But that recommendation was largely based on younger adults with healthy kidneys and faster metabolism. For many people over 65, especially over 75, 400 milligrams is already at the upper edge and sometimes beyond what the body can comfortably handle. The body doesn't immediately warn you. There's no alarm bell. Instead, symptoms appear slowly. You may feel more tired than usual, a little unsteady on your feet, a bit foggy in the morning, or notice your blood pressure running lower than normal. Most people never suspect magnesium. The second common mistake is taking magnesium at the wrong time of day. Magnesium relaxes muscles and calms the nervous system. That's why many people take it at night. For some seniors, that's fine, but for others, especially those who already have low or borderline blood pressure, taking magnesium at bedtime can cause problems during the night and early morning hours. Blood pressure naturally drops when we sleep. When magnesium is added on top of that, it can drop too far. This is why some seniors wake up feeling extremely weak, dizzy, or lightheaded when they first get out of bed. They stand up too quickly. Their blood pressure doesn't adjust fast enough and they feel like they might faint. This is not rare, and it's often blamed on getting older. In reality, it's often timing. The third mistake is choosing the wrong form of magnesium. Not all magnesium behaves the same way in the body, especially in older adults. Magnesium citrate, for example, is commonly used for constipation. It pulls water into the intestines. But in seniors, this can lead to dehydration if fluid intake isn't carefully maintained. Dehydration plus magnesium can significantly worsen dizziness and low blood pressure. Magnesium glycinate is highly absorbable and calming. That sounds good, but in sensitive older adults, it can overly suppress the nervous system, leading to fatigue, slowed reaction time, and imbalance. Magnesium oxide is poorly absorbed, but because of that, people often take higher doses thinking it's weaker. That can still cause problems in the gut and interfere with other medications. Most seniors are never told that the form matters as much as the dose. The fourth mistake is combining magnesium with certain medications without realizing the interaction. This is extremely common. Magnesium can intensify the effects of blood pressure medications, especially calcium channel blockers and certain diuretics. It can also interact with medications for heart rhythm, thyroid conditions, and diabetes. For example, a senior might be stable on their blood pressure medication for years. Then they add magnesium for sleep. Slowly, their pressure begins to run lower. They start feeling dizzy when standing. They feel weaker walking upstairs. The medication hasn't changed, the magnesium has. Another frequent mistake is taking magnesium without monitoring symptoms. Supplements are often treated as set it and forget it. People take them daily without ever reassessing whether they're still needed or whether the dose is appropriate. But in older adults, the body changes year by year. What felt fine at 68 may not feel fine at 75. Magnesium should never be taken blindly for years without reevaluation. One more critical mistake is ignoring early warning signs. Dizziness when standing, feeling faint, sudden fatigue, unusual weakness, mental cloudiness. These are not just signs of aging. They can be signals that magnesium is pushing the body too far in the wrong direction. Too often, seniors tolerate these symptoms because they believe they're inevitable. They're not. The goal of magnesium is to support health, not reduce independence, balance, or confidence. In the next part of this video, we're going to talk about why magnesium affects blood pressure, balance, and the brain so strongly in older adults, and why seniors are far more sensitive to these effects than younger people. Once you understand this, the risks and the right way to use magnesium will become much clearer. To understand why magnesium can quietly cause problems in older adults, we need to talk about blood pressure and balance, because this is where the real danger often appears. As we age, the body's ability to regulate blood pressure becomes less reliable. In a younger person, standing up triggers an almost instant response. Blood vessels tighten, the heart rate adjusts, and blood flow to the brain is maintained without effort. In older adults, that system slows down. Blood vessels are stiffer, nerve signals travel more slowly, the heart responds with a delay. This makes seniors much more vulnerable to sudden drops in blood pressure, especially when changing positions. This condition is called orthostatic hypotension, a significant drop in blood pressure when moving from lying down or sitting to standing. It's one of the most common and most dangerous causes of dizziness and falls in older adults. Now let's bring magnesium into the picture. Magnesium relaxes smooth muscle. That includes the muscles and blood vessel walls. When blood vessels relax, blood pressure drops. That effect can be mild or pronounced depending on the person. In younger adults, the body usually compensates quickly. In seniors, it often does not. This means magnesium can quietly worsen orthostatic hypotension even when blood pressure readings look fine at rest. A senior might measure their blood pressure sitting down and see a normal number. But when they stand up, pressure can drop sharply. Blood flow to the brain decreases for several seconds, sometimes longer. That's when symptoms appear: lightheadedness, blurred vision, weakness in the legs, a feeling of being unsteady or off balance, and sometimes a fall. Falls are not minor events in older adults. A single fall can lead to fractures, hospitalization, loss of independence, and long-term decline. That's why anything that increases fall risk deserves serious attention. One reason magnesium-related falls are so dangerous is that they often go unrecognized. The supplement doesn't feel strong. It's seen as natural. People don't think to question it. Timing makes this risk even higher. Many seniors take magnesium at night to help with sleep, but blood pressure naturally drops during sleep. Heart rate slows. The nervous system becomes less active. If magnesium lowers blood pressure further during the night, seniors may wake up with pressure that is already too low. When they get out of bed in the morning, their body struggles to adjust. This is why early morning is one of the highest risk times for falls in older adults. Magnesium also affects the nervous system directly. It reduces excitatory nerve signals, which is why it can calm anxiety and promote sleep. But in excess or in sensitive seniors, it can also reduce alertness, slow reaction time, and impair coordination. These changes are often subtle. A senior may not feel sedated, they may just feel slightly slower, less steady. But even small changes in balance significantly increase fall risk. There's also the issue of dehydration. Many older adults are mildly dehydrated without realizing it. Some limit fluids to avoid nighttime bathroom trips. Others take diuretics that increase fluid loss. Certain forms of magnesium can worsen dehydration by pulling water into the intestines or altering electrolyte balance. Dehydration alone lowers blood pressure. Combined with magnesium, the effect can be substantial. Now let's talk briefly about the heart. Magnesium plays an important role in heart rhythm. For some people, it can reduce palpitations or irregular beats. But in seniors already taking heart or blood pressure medications, magnesium can sometimes slow electrical conduction too much. This may cause fatigue, weakness, or a vague sense that the heart is not responding the way it used to. Again, these symptoms are frequently blamed on aging, but they're often medication-supplement interactions. What makes magnesium especially tricky is that these effects rarely happen overnight. They develop gradually. Seniors adapt without realizing it. They stand up more slowly. They hold on to furniture. They stop going out as much. Their world quietly shrinks. Magnesium is supposed to improve health and comfort, not reduce confidence, balance, or independence. The most important takeaway from this section is simple. If you are a senior taking magnesium and you experience dizziness when standing, balance problems, unexplained fatigue, or lower than usual blood pressure, magnesium may be part of the cause, even if your dose seems reasonable. In the next part, we're going to focus on how to use magnesium safely as you age, including which forms tend to be better tolerated, how much is often enough, and which seniors should avoid magnesium altogether. This is where we move from understanding the risk to making smarter, safer choices. Now that you understand why magnesium can cause problems in older adults, let's talk about how to use it safely. Because for many seniors, magnesium is not something that must be avoided, but something that must be used correctly. The first rule for seniors is simple: less is often enough. Most older adults do not need large doses of magnesium. In fact, many do better with much lower amounts than what is commonly recommended on supplement labels. For many people over 65, a daily dose in the range of 100 to 200 milligrams is often sufficient. Some seniors feel benefits with even less. Starting low allows you to see how your body responds without pushing it too far. High doses are rarely necessary and frequently cause problems. If magnesium is helpful, you should notice improvement without feeling weaker, dizzier, or more fatigued. If those symptoms appear, the dose is likely too high, even if it looks normal on paper. The second key factor is timing. Taking magnesium at night works well for some seniors, especially those with muscle cramps or difficulty sleeping. But for others, particularly those with low or borderline blood pressure, nighttime magnesium can increase the risk of morning dizziness and falls. For these individuals, taking magnesium earlier in the day may be safer. Some do best taking it with lunch or the early evening meal rather than right before bed. There is no universal best time. The right timing is the one that does not cause dizziness, weakness, or balance issues. The third factor is choosing the right form of magnesium. This matters more in older adults than in younger people. Magnesium glycinate is often better tolerated and less irritating to the stomach, but it is strongly absorbed and can be very calming. Seniors who are sensitive to sedation or balance issues should use lower doses. Magnesium citrate is commonly used for constipation. It can be effective, but it pulls water into the intestines. In older adults, this increases the risk of dehydration, which can worsen low blood pressure and dizziness. Magnesium oxide is poorly absorbed and often causes digestive side effects. Many seniors take higher doses of it thinking it is weaker, which can create unnecessary problems. No single form is perfect. The goal is to use the lowest effective dose of a form that does not worsen blood pressure, balance, or hydration. Another critical point is monitoring symptoms, not just numbers. If you take magnesium, pay attention to how you feel when standing up. Notice whether you feel lightheaded, weak, or unsteady. Watch for changes in energy, alertness, and balance. These signals matter more than hitting a specific dose. Magnesium should never reduce your confidence in walking or standing. Now let's talk about who should be especially cautious or avoid magnesium unless supervised by a doctor. Seniors with chronic kidney disease should be very careful. Reduced kidney function makes it harder to clear excess magnesium, increasing the risk of accumulation. Older adults with frequent dizziness, fainting spells, or known orthostatic hypotension should approach magnesium cautiously, if at all. Those taking multiple blood pressure medications, heart rhythm drugs, or diuretics should not add magnesium without discussing it with their healthcare provider. And seniors who have had recent falls should reassess every supplement they take, including magnesium. Another important rule is don't stack magnesium sources. Many people unknowingly take magnesium from multiple products: a sleep supplement, a multivitamin, an antacid, and a separate magnesium pill. Individually, each dose seems small. Together, they add up. This is a very common cause of unintended overuse. Finally, magnesium should be reassessed regularly. What works at 68 may not work at 75. The body changes, medications change, health status changes. Magnesium is not a lifetime set-it-and-forget-it supplement. The goal is simple. Magnesium should make you feel more comfortable, more stable, and more rested, not more cautious, more tired, or more afraid of falling. In the next part, we're going to talk about real-life warning signs that magnesium may be doing more harm than good and exactly when it's time to stop, adjust, or rethink supplementation altogether. This is where awareness can prevent serious problems before they happen. One of the biggest dangers with magnesium in older adults is not immediate toxicity. It's the slow, quiet warning signs that are easy to ignore. Magnesium problems rarely announce themselves clearly. They whisper first. That's why seniors and their families often miss them. The most important warning sign to pay attention to is dizziness when standing up. If you notice that standing from a chair or getting out of bed makes you feel lightheaded, unsteady, or briefly weak, that is not something to dismiss, especially if this started after adding magnesium or increasing the dose. This is often the first sign that magnesium is lowering blood pressure too much for your body to handle. Another early warning sign is unusual fatigue. Not normal tiredness at the end of the day, but a persistent sense of low energy, heaviness in the legs, or feeling drained even after resting. Some seniors describe it as feeling slower or less sharp than before. This can happen when magnesium suppresses the nervous system too much or interferes with heart rate response. Balance changes are another red flag. If you feel less confident walking, need to hold on to furniture more often, or hesitate when turning or stepping, pay attention. Even small balance changes significantly increase fall risk in older adults. Magnesium does not have to cause dramatic dizziness to be dangerous. Subtle instability is enough. Another warning sign many people overlook is mental fog or reduced alertness. Magnesium affects the brain. In appropriate amounts, this can be calming. In excess, it can dull reaction time, slow thinking, and reduce focus. Seniors may feel less engaged, less responsive, or slightly detached. This is not normal aging. It's a signal that the nervous system is being suppressed more than intended. Digestive changes can also be clues. Loose stools, increased bowel urgency, or dehydration, especially with magnesium citrate, can indirectly worsen blood pressure and balance by reducing fluid levels. Dehydration plus magnesium is a dangerous combination for seniors. Now let's talk about when magnesium should be reduced or stopped immediately. If you experience repeated dizziness, near fainting, or actual falls after starting magnesium, stop taking it and speak with your healthcare provider. If your blood pressure readings begin trending lower than usual, especially systolic readings, magnesium may be contributing. If you feel weaker, less stable, or more fatigued without a clear explanation, magnesium should be reconsidered. Stopping magnesium is not dangerous for most people. Continuing it when it's causing harm is. Another critical step is checking posture-related blood pressure changes. If possible, measure blood pressure while sitting, then again after standing for 1 to 3 minutes. A significant drop suggests orthostatic hypotension. If magnesium is part of your routine and this drop is present, the supplement may be worsening the problem. It's also important to reassess magnesium after any change in health status. Hospitalizations, new medications, weight loss, dehydration, kidney issues, or recent illness all change how the body handles minerals. A dose that was once tolerated may suddenly become too much. This is why magnesium should never be considered permanent without reassessment. Now let's address a common misconception. Many seniors believe that because magnesium is natural, it cannot cause harm. That belief is dangerous. Natural substances still affect physiology. They still interact with medications. They still require appropriate dosing. Magnesium is not harmful by default, but it is not harmless either. The goal is not to avoid magnesium unnecessarily. The goal is to use it in a way that supports strength, balance, and independence, not undermines them. In the final part of this video, we're going to bring everything together. I'll summarize how seniors should think about magnesium, what questions to ask their doctor, and how to make decisions that prioritize safety, stability, and quality of life. This is where understanding turns into action. Let's take a step back and bring everything together. Magnesium is not a bad supplement. For many seniors, it can be helpful when used carefully. But the idea that magnesium is automatically safe for everyone at any dose and at any age is simply not true. As we get older, the body changes. Kidneys clear minerals more slowly. Blood pressure becomes more sensitive. Balance and reaction time matter more than ever. Because of this, magnesium that once felt harmless can quietly begin causing problems, especially dizziness, weakness, low blood pressure, and increased fall risk. The most important lesson here is that one size does not fit all. The right dose for a healthy 65-year-old may be wrong for a 75 or 80-year-old. The right form for one person may be poorly tolerated by another, and the right timing can make the difference between better sleep and a dangerous morning fall. For most seniors, lower doses are safer. For many, timing matters more than amount. And for some, magnesium may not be appropriate at all without medical guidance. What matters most is how you feel. If magnesium improves comfort, sleep, or muscle function without causing dizziness, imbalance, or fatigue, it may be a good choice for you. But if it reduces confidence in walking, standing, or thinking clearly, that is a signal to reassess. Supplements should support independence, not slowly take it away. If you are taking magnesium, Pay attention to changes in balance, energy, blood pressure, and mental clarity. Watch for dizziness when standing. Notice whether you feel weaker or less steady than before, and don't hesitate to discuss this with your doctor. Bring up the supplement. Ask whether the dose is appropriate for your age and medications. Ask whether timing or form should be adjusted. These conversations matter. Finally, remember this: aging well is not about chasing perfect numbers or following supplement trends. It's about staying steady on your feet, clear in your mind, and confident in daily life. Magnesium should never compromise those goals. If this video helped you understand magnesium differently, consider sharing it with someone you care about, especially another senior who may be taking supplements without realizing the risks. And if you'd like to continue learning how to protect your heart, balance, and overall health as you age, make sure you're subscribed to this channel. We'll keep focusing on what actually helps and what seniors need to be careful with. Thanks for watching.